you're coming from, it would be so wonderful to hear from you. I'm about to hand over to the moderator for the day, who is Dr. Bernard Nkuibwasi. He's about to start right now, and I'll be managing the chat room. He will introduce the entire program. So I want to hand over to him right now. Over to you, Bernard.
Thank you, Victoria. Can you hear me? Can you confirm you can hear me?
Please increase your microphone volume.
How about now? Hello, can you
just a little more? Thank you. We hear you very well, but just a little more volume, and then you start. Thank you very much.
Yeah. That's the maximum. That's the maximum. All right. Can you hear me?
It's okay. Please go ahead.
Yep. All right. Thank you, Victoria, and thank you everyone for joining this webinar.
Yes.
And a warm welcome to this webinar, everyone. It is a great pleasure, honor, and privilege to host you in this virtual discussion on supporting the health and well-being of teachers and teacher educators during the COVID-19 crisis in Africa. This webinar and the webinar will start with welcome and opening remarks from the director of the Unesco International Institute for Building in Africa. Then we move to the keynote speaker, and after the first invited speaker. After the first invited speaker, we will move to the panel discussion, and the panel discussion will be followed by answers to questions that will be in the chat room that will be moderated by Victoria. And after the chat room, questions are addressed. We will move to the second invited speaker, and finally, the closing remarks. Please mute your microphones when you are not speaking. And if you have not yet done so, we would like to invite you to type your name and the organization you are representing in the chat room. To enter the chat room, please click on the message icon at the bottom of the webinar. And anytime you have any question, please type it in the chat room so that the chat moderator collects it and they address it to the appropriate speaker. Please reminder, if you are not a speaker, will you please mute your microphone? And I wish you a wonderful time in this webinar. And now we move to the opening remarks by Dr. Yumiko, the director of the UNESCO International Institute for Building in Africa. Yumiko, the floor is yours.
Thank you, Bernard. Can you hear me?
Yeah, I can hear you.
Yes, we can hear you very well.
Okay, dear colleagues and friends, good afternoon, or good evening, or good morning, wherever you are joining. Welcome to this regional webinar on supporting the health and well-being of teachers and teacher educators during the COVID-19 crisis in Africa. Hello, and if you're not talking, please mute your microphone. That will make it easier for all of us. So thank you for creating this time to participate in this webinar. I believe this is the first webinar for health and well-being of teachers we are holding. We have been holding a number of webinars since end of March, every week almost. Now this webinar has been organized by Unesco ICBA in collaboration with the UNESCO Section for Education for Health and Well-being through a Swedish CEDARS funded project called Our Rights, Our Lives, and Our Future, O3. The overall goal of this webinar is to create an opportunity for educational authorities, education partners, school leaders, teachers, and the teacher educators to explore and discuss the health-related and psychosocial support concerns that the teachers, teacher educators, and the school leaders might have regarding a school reopening during and post-COVID-19. We all know that the COVID-19 pandemic has left many issues at stake in schooling in the disruptions we have encountered. teachers have not been spared at all. In fact, they are overwhelmed, struggling to keep afloat in this tide. The webinar is therefore intended to provide a platform for us all to the following three objectives. Number one, to reflect on the concerns that the teachers, teacher educators, and school leaders might have regarding school reopening during the post-COVID-19, regarding the health and well-being. Second, to discuss the potential challenges school leaders, teachers, and teacher educators may face in providing health and psychosocial support following the school reopening. And the third, to revise the strategies to increase teachers' readiness to implement infection prevention and control measures to promote well-being environment during and after school reopening. As I conclude, let me remind you that the African Union Continental Strategy for Africa, in its strategic objective 1 on revitalizing the teaching profession, demands that we provide good working and living conditions to teachers in order to enhance their status and value in society. The same sentiments are echoed in UNESCO and the ILO recommendation concerning the status of teachers, published in 1966, and the UNESCO recommendation concerning the status of higher education teaching personnel, published in 1997. You all hear more from the speakers in this webinar. So I wish you all the useful and the interactive webinar session on this very important theme. Thank you very much. Over to you, Bernard.
Thank you very much, Yumiko, for that very nice introduction and a warm welcome to the participants. And before I move to the keynote speaker, I would like to give you a friendly reminder. Please, if you are not speaking, would you please mute your microphone so that the voice comes with high quality. Now we move to our keynote speaker. We move to our keynote speaker, Ms. Hello? Can you mute your microphone, please, if you are not speaking? I can still hear echoes. So we move to our keynote speaker, who is Ms. Peneambeko Mkawa, who is the occupational safety and health specialist for Eastern and Southern Africa at the International Labour Organization. Peneambeko likes to be called Penny, and Penny is going to present talk about the UNESCO and International Labour Organization recommendations and the well-being of teachers and teacher educators amid the COVID-19 crisis in Africa. Penny, the floor is yours.
Thank you very much. Good afternoon, everybody. Dear esteemed colleagues, the government representatives, the employers and the workers' representatives, teachers, distinguished stakeholders and partners in education, ladies and gentlemen, all protocol, and good afternoon again. And may I just request the colleagues to mute their mics while they are not speaking. It is my privilege and honor on behalf of International Labour Organization, ILO, and the organizers of this event to address you during this regional webinar on supporting the health and well-being of teachers and teacher educators during the COVID-19 crisis in Africa. I would like to thank UNESCO, International Institute for Capacity Building in Africa, for putting it all together and making it possible for us to have this dialogue. The gesture of participating in this webinar shows your compassion to dialogue and deliberate on strategies to improve the efficiency and effectiveness of our education systems and better support the teaching and workforce amidst and post the current COVID-19 pandemic. May I please request the colleagues to just switch off their cameras for the quality of the connectivity. As we are all aware, the emergency of the COVID-19 pandemic has led to significant loss of jobs in the first half of this year in many sectors. In fact, it's estimated that about 305 million people lost jobs already. Teachers have not been spared either, as millions of learners were sent back home to fulfill the lockdowns and the social distancing measures. As of 7th of June 2020, approximately 1.7 billion learners were affected already due to school closures in response to the pandemic. According to UNICEF monitoring, 134 countries are currently implementing the nationwide closures, and about 38 are implementing the local closures, impacting about 98% of the world's student population. Schools have progressively been opened in about 39 countries, and school closures are not only affecting students, teachers, and their families, but have the far-reaching impact, economic and societal impacts, including the health and the well-being of the teachers, to whom teaching is not just a job, but a calling. In the United States alone, nearly 800,000 teachers have lost their jobs in the month of April and May 2020. The director of the ceremonies, I'm really receiving some feedbacks. If the participants can just mute the mics and switch off the cams, I would really appreciate that.
Hello. Everyone, can you hear me? Can you please switch on your microphones and your videos if you are not speaking? Penny, back to you.
Thank you so much, Director. In the United States alone, nearly 800,000 teachers have lost their jobs in the month of April and May 2020, while others face uncertainty amidst the school budget cuts during the coronavirus pandemic. This is not just a financing gap, but also a blow on many's livelihood and the well-being of teachers. We have since noted that in order to protect the safety and health of the teachers and the general public, governments in different parts of the world have increased the spending on education, particularly towards the deployment of online and distance teaching technologies. In the least developed part of the world, however, factors such as the teachers' digital and ICT skills to turn the teaching materials into the digital platforms or formats, and the fact that less than 20% of the households have internet connectivity, such interventions are being. The eventualities of the lack of appropriate facilities and infrastructures, on top of our prolonged disruption of education and teaching in already disadvantaged communities, include many poverty triggers such as inequalities in education, exclusion of learners with disabilities, the high rates of dropout, and child labor. Such eventualities are devastating to the societies in general and to the calling in particular. The pandemic of this magnitude and its impact on the education sector is to date unmatched. However, the well-being of teachers and effectiveness of teaching services occupied the international fora for decades. Such led to adoption of instruments that provide guidance for governments, employers, and teachers' unions, as well as the other stakeholders in crafting of effective teachers' policies. The ILO UNESCO recommendations concerning the status of teachers was adopted in 1966, and the UNESCO's recommendation concerning the status of higher education teaching personnel in 1997. These set forth the rights and responsibilities of teachers and the standards for their initial preparation and further education, recruitment, employment, teaching and learning conditions, as well as their participation in decision-making. The Joint ILO-UNESCO Committee of Experts on the Applications of Recommendations concerning teaching personnel, recommends that they recommend the need to pay attention to teachers' motivations and their well-being, which are deemed essential delivery of higher quality teaching services. They further recommend strengthening mechanism to recognize the rights and responsibilities of teachers, including appropriate systems of accountability and quality assurance, improving conditions for effective teaching and learning. The said instruments, ladies and gentlemen, and the state's commitments thereto have become even more relevant and important as we navigate the response to COVID-19 and try to mitigate the impact of this pandemic. Teachers more than ever, they need access to adequately resourced and safe teaching environments and decent work. Governments, employers, workers, and partners in education should now prepare to design and implement immediate crisis response and return to school policies, taking into consideration the needs of the learners and the teachers, based on the principles of equity and balancing the need between the academic achievement with the management.
Penny, can you hear me?
Yes, I can
Penny,
hear
can
you.
you hear me?
Yes, I can hear you.
In about 1 minute? Can you wrap up in about 1 minute, please?
Yes, I am just about to conclude. Thank you. Balancing the need of your academic achievement with the management of well-being during this global crisis. So professional support and training, occupational safety and health, employment and working conditions, and involvement in the education response should be at the center of social dialogue and the strategies targeting the education sector. As I am now concluding, ladies and gentlemen, allow me to share a wise statement by an unknown author. I quote, "Teachers have three loves: love of learning, love of learners, and the love of bringing the first two loves together." End of quote. I therefore encourage you to deliberate on innovative strategies which governments, employers, teachers, and education partners should dialogue on to bring learners and learning together, physically or virtually, and subsequently safeguard the teachers' well-being during and post-COVID-19 crisis. With these few words, I wish you all a fruitful deliberation or session, and thank you very much for your very kind attention. Thank you very much, Chair.
Thank you very much, Penny, for this presentation and highlighting some concerns about teacher well-being, but also what may be the options for teachers to continue to provide education while being safe. And we quickly now move to the next speaker. We are lagging behind some minutes. We move to the first invited speaker, who is Dr. Patricia Mashawira. Patricia is the regional advisor for the Eastern and Southern African region at UNESCO. And Patricia will be talking about the context of teacher health and the well-being in the Eastern and Southern African region. Patricia, you have 10 minutes, please. The floor is yours.
Thank you very much, Bernard. Can you hear me?
Yeah, I can hear you very well.
Okay. Thank you, colleagues, and thank you to ICBA for organizing this webinar, and to all the partners who've come on board to share and reflect on the health and well-being of teachers during this COVID crisis. So in my presentation today, I'm going to be showing a video. So to help with the bandwidth, I'm going to ask, sorry colleagues, Patrick, Hasina, and Eric Gitter, if you can switch off your cameras so that we are able to share the bandwidth. Thank you. So I don't know, are you able to see the screen? Are you able to see the presentation?
Yes, we are able to see that.
Yes.
Hanok, do you mind if I share my screen instead?
Yes, I can see it from my side. I guess.
Yes, Patricia, you can share your screen.
If it's okay, allow me to share. So can you remove the presentation so that I can share my screen, if it's okay?
Jose, can
Are you removing the presentation?
Let me remove this one. Let me end this one, please.
Okay.
Yeah, if you can exit that one so I can.
I guess
that is your screen, I think. I think that is your screen now.
Yes, this is Patricia's screen.
Yeah, Patricia, go on. It's your screen now. Go on.
Okay. I'd wanted to be able to see my speaking point, but it's fine. So this afternoon, I'm going to be talking to you about the context of teacher health and well-being in the Eastern Southern Africa region. As introduced, my name is Patricia Machawira, Regional Advisor for Education for Health and Well-being for the Eastern Southern Africa region. So just to talk a little bit about the work of the team on education for health and well-being. Why education for health and well-being? We know that health is fundamental to education. When learners are healthy and happy, they learn better. And we know that poor health has detrimental effects on school attendance and performance of learners. So the work that we do under the Education for Health and Well-being unit speaks to the 3 SDGs around education, health, and gender equality, and it's guided by the UNESCO strategy on education for health and well-being, which has 2 strategic priorities. The first one being to ensure that all children and young people benefit from good quality comprehensive sexuality education. That includes HIV education. And the second one being to ensure that all children and young people have access to safe, inclusive, non-discriminatory, and health-promoting learning environments. So as part of the work that we are doing in the lead up to the addressing the COVID crisis, we have developed a series of videos which are aimed at helping learners to cope to cope with the COVID crisis. So I'm going to play for you a 2-minute video, which is part of a series, and it's targeting learners as schools reopen. So just bear with me a little bit. I'm going to try and share my sound. Sorry, can you hear me?
We can hear you, but we cannot hear the video.
Sorry, let me try that again. I need to be able to share the sound with you.
All right. Okay. In the meantime, if anyone who is not presenting still have the video on, please switch it off.
I think I see Patrick Okello has their video is on, and Patrick Kaboyo also has their video on.
Patrick, would you turn the camera off, please?
I've switched it off.
And also, please switch the microphone off if you are not present.
Prevent the coronavirus. Wash your hands for at least 20 seconds. The more often, the better. Before going out and after spending time in public places, good hygiene must continue. Mind your hands and keep them away from your face, especially your eyes, nose, and mouth. Temporarily say no to handshakes, hugs, and kisses. Sneeze and cough carefully. The best way is to cover your mouth and nose with a tissue and then immediately discard it. Another option, cough or sneeze into your elbow. Avoid crowded places. Stay at least 1 meter away from other people. And avoid public transport. Your health matters. You should stay home if you do not feel well. And inform your parents, teacher, or caregiver. Be kind. Do not stigmatize your peers or tease others about being sick. Remember, the virus does not follow geographical boundaries, ethnicity, age, ability, or gender. Rely on news only from trusted sources. Continue to double-check what you read in social media against official information published by the World Health Organization, WHO, National Health Institutes, and mainstream media. Be a leader in keeping yourself, school, and community healthy. Together, we shall overcome this virus.
So thank you for this. I hope you were able to see. I hope you were able to see the video. I'm going to now go back and continue with the presentation.
Yes, we could see the video. Go on, Patricia.
Okay. Okay, so the video focused on addressing and helping learners to cope when schools reopen. But we know that learners matter, but also teachers are really important. So from the beginning of the crisis, teachers have been vital to ensure that learning continues through supporting learners via distance learning and also looking after learners' well-being. So as countries started talking about, school reopening, there are a lot of discussions, a lot of, thinking around how do we ensure that the needs of the health and well-being of teachers is addressed. Firstly, as individuals who are affected by COVID themselves, but also as frontline workers who we expect to be helping learners to cope with the impact of COVID-19 and ensuring that the learning environment remains safe for learners and for the teachers themselves. So I'm sharing with you a quote there from one of the teacher unions in Zimbabwe in the discussions leading up to the school reopening. Heads and teachers are traumatized by the ravaging COVID-19 and therefore need social and financial support. There should be no threat posed on their lives and families. So it's really underlining the importance of teachers feeling safe themselves before they're able to come into schools and address the needs of learners. So just to go on to talk to what is the situation in the Eastern Southern Africa region regarding teacher health and well-being, we did a quick analysis of the situation in a number of countries in Eastern Southern Africa. What was clear is that a number of countries have reopened schools. Some countries had made and provided had made pronouncements around when schools would open, but this has been reversed as the numbers of COVID-19 infections are increasing. reopening. So this is the case in countries like Zimbabwe and Mozambique, where they'd put a date towards the end of July for opening schools, but they've now reversed this to assess the situation given the increasing number of cases. We have countries like South Africa who have reopened schools and are having to battle with the challenges around the reopening. So just a quick snapshot of what's happening in the region. So firstly, in terms of what measures have been put in place by the different countries to address the health and well-being of teachers. So we've seen a number of countries coming up with guidance, on how schools should operate to prevent and manage COVID-19, as well as how to deal with issues of health and well-being. This again has been accompanied by guidance from, the international community, from Unesco, World Bank, UNICEF, and others who provided guidance around the framework for reopening schools. We've seen schools being provided with PEP, personal protective equipment, learners, education, and non-teaching staff provided with cloth masks and soap, school buildings cleaned and disinfected prior to reopening, and all learners and staff screened for temperature. Social distancing measures, we've seen these in place where a number of measures have been taken, including reducing class sizes, cancelling assemblies, or any activities that bring, large numbers of people and young people in close proximity. Schools provided with guidelines on how to isolate learners and staff in case of suspected cases of illness. We've seen, I think, access to water and sanitation was a challenge in a number of countries, particularly in rural areas. So we've seen a number of efforts focusing on increasing access to water and sanitation in schools to promote good hygiene and proper hand washing. Some countries providing psychosocial support to both learners and staff to address the anxiety and distress accompanying the issues of COVID. Some countries providing orientation for all teachers ahead of reopening, designation of areas sick base for both teachers and learners, testing of teachers prior to reopening in some countries, designation of health coordinators per school to coordinate COVID-19 activities. What are some of the challenges that teachers are facing during this period? So firstly, even before schools were opened during the closure period, teachers had to find ways to support learning remotely using online platforms, which posed a challenge as some teachers found themselves in situations where they had to use their personal data. This was very common, particularly for those teachers who are teaching exam classes. Teachers also experiencing feelings of anxiety, stress in coping with the pandemic, but at the same time, they having to provide support that learners need in dealing with their own fears and anxiety. With an average class size of around 40. Hello?
Patricia, can you hear me?
Yes,
yeah,
I
can you wrap up in about 1 to 2 minutes, please?
Okay, 2 minutes is more realistic. So with large class sizes in a number of countries, the classes had to be divided into two, leading to additional work for the teachers. In a number of countries cited increasing teacher workload, especially where some parents choose that their children will not attend school, but will continue to work from home, which means that the teacher has to address the learners who are in school, but also reach out to those who are learning from home. What we found is that most teachers from private schools did not receive salaries during periods of school closure. And then some teachers were exposed through professional interaction with other peers, social distancing difficult, especially with overcrowded classrooms. We have instances where, teachers were infected during school, even as they were going to school to deliver online lessons to learners. Lack of psychosocial support and adequate medical cover for teachers was one of the issues that were raised. So in terms of what needs to be done, these are the voices from the field in terms of what needs to be done to safeguard the health and well-being of teachers. So ensuring teachers have access to counseling and support, reviving health and wellness programs for teachers, the need to split big classes into smaller, more manageable classes to allow social distancing, volunteers to support teachers to help enforce social distancing among learners, especially during break times, partnerships with the private sector, school-based support teams to provide support to schools, to manage the psychosocial needs of learners and educators, orientation of staff on how to handle infected children, ensure support is provided to ensure that learning institutions adhere to COVID-19 infection and prevention guidelines. So this is my last slide. So this speaks to really a new world that teachers are facing with the advent of COVID. And I'll just speak now to the recommendations that came from guidance for policymakers that was developed by ILO, UNESCO, and the task force on teachers, on supporting teachers in their back to school efforts. So it gives, you can look up the document, we can share with you the link, but basically this guidance really outlines a number of areas that countries need to address to ensure the health and safety of teachers during this period. Thinking about as schools reopen, how school leaders can clearly communicate to teachers and staff that their health, safety, and well-being is a priority. Promote self-care and peer networks so that teachers can also support each other, through WhatsApp groups and so on. We've already seen examples of this in countries like DRC and Uganda. Upholding working conditions for teachers and ensuring that education systems have adequate and qualified staff that are mobilized, motivated to support teaching during this time. And then finally, investing in education responses to address teachers and schools' changing needs. Mr. Moderator, I'm going to end here. We can provide links to the video and also to the guidance to the participants. Thank you.
Thank you, Patricia, for that nice presentation. If you have some links you want, please share them in the chat room. And we now move to the panel discussion. And I would like to invite Ms. Marie Antoinette, who is General Secretary at the Gambia Teacher Union. Marie Antoinette is going to talk about addressing the key concerns of teachers when schools reopen. So Marie Antoinette, you have 7 minutes. Marie Antoinette, can you hear me? Marie Antoinette, can you hear me? Hello, Marie Antoinette?
Yes, can you hear me? Hello?
Yes, I can hear you. Yep. Go ahead.
Put this. Can you hear me now?
Yes, wow. Indeed.
Can you hear me? All right.
Yes, I can. All right. Good afternoon, everybody, or good morning, everybody. Let me quickly say I'm happy to join this panel, and I am to talk on the in-teachers when schools reopen. But quickly, let me say for us in the Gambia, grade 9 and grade 12 students have reopened, meaning the teachers and the students are in school. The grade 9 students are in school and the grade 12 students are in school. But before schools reopened, of course, teachers raised a lot of concern because every day we have cases increasing. And of course, you all know Gambia is very small. But what we did, we used our platforms, our regional platforms, to sound the teachers and find out from them what their concerns were. And of course, we got a long list of concerns, like the personal protective equipment, how are the students going to observe the physical and social distancing, how are you going to get the hand washing materials, what about the face mask, will one face mask be enough, etc. But for us at Gambia Teachers Union, we are lucky. We are members of the task force that is set up by the Ministry of Basic and Secondary Education. So we took those concerns to the ministry and they tried very hard to address most of them. For example, before schools reopened, all the schools were fumigated. Also, face masks were provided for both the teachers and the students. It was made known to all the head teachers that they should decongest the staff and also make sure that the desks and tables are arranged in such a way that the students will observe the physical distancing. Also, the teachers were so traumatized because they call themselves frontliners. And of course, we know, yes, I can comfortably also call them that way. So we organized sensitization programs for the teachers, telling them that we had a meeting with the ministry and that some of these things have been put into consideration and that they will be provided for. Also, we organized radio programs to sensitize our members. We made sure that all those people who were to use the thermometers were trained on how to use the thermometers. Sanitizers were provided for the teachers and the students in the schools. We also provided posters that we pasted in all the schools. We went around. Personally, I went to 22 schools in 2 days, and we visited a number of schools. So the teachers, yes, they are concerned, but in our own way, we are trying to address the concerns. We organized a series of radio programs. We even went to the extent of giving our leaders mobile phones so that they will be able to communicate, because we are trying to encourage them not to be moving about. So as a union, we gave them mobile phones. And as a ministry, working with the Gambia Teachers Union, we have gone round many schools to observe. And where we noticed that the school was not fumigated or the face masks were not enough, we will quickly alert the Ministry of Basic and Secondary Education to say, look, we went to school X and we realized that the face mask that we are supplied to them was not enough, so they will provide. So as I said, schools have reopened, yes. Teachers have concern, yes. We are trying to address the concerns. And where we have gaps here and there, we try very hard to fill in the gaps. It is not 100%, but we are winning. We still have concerns to address, but as they come, we try together with the Ministry of Basic and Secondary, together with the National COVID Response Team, we have been trying very hard to address the concerns that the teachers have. So we are hard on it. Network.
Hello, Maria Antoinette. Can you hear me?
Yes, the network just decided to do.
Can you wrap up in the next couple of minutes, like not more than 2 minutes, please?
Yes, we tried very hard to sensitize our members using different platforms, print and electronic media. We even brought them in groups of 7 to give them basic skills on counseling, so that when they go back to school and the teachers have issues like they are traumatized or whatever, our school reps will be able to support them in those respects.
Hello, Maria.
Yes. Yes, I'm here, but the network is horrible.
Yeah. That's fine. All right, please wrap up quickly, the next couple, in 1 minute.
No, I'm just, as I said, I'm okay. We are working very hard with the Ministry of Basic and Secondary Education to address the concerns of the teachers who are already in school, the grade 9s and the grade, so their teachers are back. Thank you.
All right, thank you. Thank you so much, Marie Antoinette, for sharing that experience in the Gambia, how the Ministry of Education has been working with Teachers Union to minimize that concern of teachers, but also for the Ministry of Education to respond or to provide responsive support to teachers. That's a very interesting experience. So now we move to the next panelist, who is Ms. Reggie Monsata. Reggie, can you hear me? Hello? Reggie Monsata, can you hear me? Hello? Hello, Reggie, can you hear me? Reggie Moses, can you hear me? Hello?
I think we can move to the next one. She might have.
Yeah.
Dropped off. So let's move to the next one as we wait for her.
So yeah, sure. If Reggie Montasa is not ready, we move to the next speakers, and then Reggie Montasa will come when we later on when the next two panelists will be sharing their experience from the teacher's perspective have completed. So Andrew Banda, can you hear me? Andrew Banda?
Yeah, I can hear you. Good afternoon.
Good afternoon, Andrew. Hello. So the next speaker is going to be Andrew Banda is the teacher at Twin Palm Secondary School in Lusaka.
Can I go ahead?
Yeah. Well,
all right. Thank you very much. Greetings to all the attendees, and I would like to acknowledge all the organizers of this very important meeting. As indicated, I'm a teacher of science at Twin Palm Secondary School, Zambia, Lusaka, and I'm going to share this afternoon the experiences that we've had. As you may be aware or not be aware, in Zambia we had, I think, our first COVID cases around March, the third week of March. And due to the alarming tension that was in the country because of the new cases, the Ministry of Education, in consultance with the Ministry of Health, did announce an indefinite closure of all schools in Zambia. And that was on the 20th of March. And having closed indefinitely, we as teachers and also as learners, we had this uncertainty as to what would come next. The challenges that were faced is not knowing what to do and how we can help our learners. For our learners, the challenge was there are learners that do receive support from schools. I work in the guidance office as well. There are learners that would receive maybe sanitary pads from schools, and others would receive meal packs. But due to this closure, it meant that they couldn't have any access to those services. Because of this, we saw a very good quick action from our ministry through the government. They introduced continuous learning, and this was facilitated through the introduction of a program, which is an online-based program, which is Smart Revision Zambia. And the ministry also introduced an education channel on the DSTV package for learners to access from lessons from grade 1 to grade 12. The challenge for learners is, as you may know, not all learners would have access to the internet. Others also just access to the bouquets that provide these services. But we still have some number of learners that were able to access, but all in all, majority were not able to access this. After the closure, the government, working in partnership with the Ministry of Health, did announce that schools would open, and that was on 1st June. But this only meant that only exam classes would open. So for us, it's year 7, year 9, and year 12. And when schools opened, before schools had opened, they did take measures to sensitize all school administrators or teachers on the procedures and how to handle themselves prior to the schools opening. With schools opening on the 1st of June, it was a new field, it's like a new way of doing education, because now there's mask wearing, you have hand sanitizers, you have washing points. So all schools had to meet their staff. I remember you would meet maybe from outside to make sure that you maintain the
are you still there? Andrew? Andrew, can you hear me? Andrew, are you still there?
Looking at the time. Yes, I'm here. Can you get me?
Yeah. Yeah,
Hello?
we lost you for a couple of seconds, but please go ahead.
Okay. So some
Andrew?
of the challenges we amid. Hello? Hello?
Go ahead. Can you wrap up maybe
Yes.
2 minutes, please?
Okay. So we are in our midpoint of our term, and these are some of the challenges. We have seen a reduction in the number of learners that are attending lessons, even amongst the exam classes. They, having stayed away from school for a long time, we did our midterm assessments. The performance of our learners has greatly been affected and their performance has gone down. We still have parents that feel their children should not attend school because of fear. I think the greatest effect that it has had on our learners is the fear. So both parents and learners have the fear. For learners who come to school because they hike, they are also facing challenges because well-wishers can't give you a lift because they too are scared of the COVID. In the last minute, allow me just to share the challenges that teachers have faced. The biggest challenge is also the fear of being in contact with a huge number of learners, and this might expose you to the virus, and everyone is seemingly scared to take this virus to their respective homes. Others, we have other people that as teachers who have reservations of doing certain duties like marking books because it entails contact. Then we also have recently in our country, we've seen an increase in the number of infections, especially at this point, the past 2 weeks. So we are seeing that the fear now amongst learners and teachers is becoming more and more, and this is leading to stress. Other teachers will absent themselves because they are thinking, look, the language is stay home and stay safe. In all this, we have had the government of Zambia with other cooperating partners, former students or pupils of our schools coming through to help our schools by making donations, giving face masks, hand sanitizer, and soaps for making sure that we wash hands. I strongly believe and feel that as we go on discussing, there is a great need for a well-structured and intervention in making sure that we have the psychosocial support both for learners and teachers. Why I say so is because we cannot fully measure the extent to which both learners and pupils are affected, be it health-wise or be it with emotion-wise. One of the great challenges we have noticed with our learners is that our learners have, of course, been affected because of their incomes. Most of them will be absent because now transport to get to their local school is a challenge. Teachers also have got fear. So as we go as Africa and as a region, our recommendation and my recommendation as a teacher, that with all these challenges that are coming, may our countries make sure that with the right professional support structures, ensure that we have proper psychosocial support systems, as this will help the post. We'll only get to see the effect of this as we go, the post-COVID, I pray so. And as I conclude, allow me to make this recommendation that may all teachers, as my colleague from Gambia said, who are also frontliners, may all teachers, teacher educators, parents, and all stakeholders in the respective countries that we have stick together and ensure that the right information is going out to our communities, because we are not fully able to control what information is being fed to our learners in their respective homes. And as a result, we still have others that still feel maybe this COVID thing, mostly in Africa, is yes.
Can you wrap up, please?
Okay. I will reemphasize that we still need well-structured social, psychosocial systems that will help both learners and the teachers from this point going forward. That way we'll be able to achieve our goals. And I wish all the participants and all the educators in Africa all the best. Thank you.
Thank you, Andrew, for sharing your experience in Zambia, and your recommendation is well noted, and I hope it will be responded to. Now we move to the next speaker, who is Cheikh Sidati. Can you hear me, Sidati? Cheikh Sidati, can you hear me?
Hello.
Yep. Can you hear me? Is that Cheikh Sidati?
Yes, I can hear you.
All
Yes.
right, that's great. So, yeah. That at the Babakar Barfor High School in Kafrid in Senegal. So, Cheikh Sidati, you have 5 minutes to give us your experience from the Senegal. The floor is yours.
Okay. Okay, thank you. Good morning, everybody. My name is Cheikh Sidati Fall, and I'm from Senegal. So I am very happy to be part of this webinar session. And I just have to summarize quickly my experience with the COVID-19, because I was a former COVID-19 patient. So our government decided last June to reopen the classes. So and we were called to do our duty in our schools, and I went to school as usual. Things were okay because we respected all the measures that the authorities had taken, such as wearing wearing face mask, and also respecting the social distancing. So everything was okay. I did my courses correctly with my students, 1 time, 2 times, etc. And unfortunately, 2 days after, I felt a kind of fever, and I thought that it was a flu. So I went to the drugstore as usual and bought there some medicines. When I took it, after it was okay, but I didn't want to go to school because I didn't know exactly what it was. So I decided to call my school authorities, especially the headmaster, and I told her what happened. So after she recommended me to a doctor who told me to come and do the test, and I did it. And the day after, they called me and told me that I was tested positive. This was a kind of shock for me because it's not easy to be infected. And unfortunately, also they tested my wife, and they said that she also was infected by the COVID-19. So it was not easy because we were obliged to be isolated, and the medical staff came in my home. They gave us the medicines, the right medicines, and it was not easy for me. And the worst thing was they told me that I couldn't touch my little kids that are here, and it was heartbroken for me to be next to my children and not being able to touch them. It was something that was very, very, it was not easy for me. So fortunately for me, 10 days after it, they came and they tested me again twice, and they said that finally it was negative. So fortunately also for me, I didn't need a psychologist because my friends, my family, my colleagues, they played well that role. They really played well that role. So they used to call me and comfort me. The academic authorities also did the same. And now I have recovered from the COVID-19, thanks to God. Hello?
Hello? Yeah, finished?
Yeah, now I have recovered from it. It was not easy. It was very difficult for me and my family. But thanks to God, everything is okay now. And for sure, there is something that I want also to mention. I haven't been stigmatized by my population. And this was something that was very, very helpful to me. And now I have started my activities. So this is a little bit what I wanted to show with you, to share with you concerning the case of, concerning my case. Now, if you have any question about it, I can answer the questions.
Thank you very much, Cheti. Thank you.
Hello? Victoria? Hello? Victoria?
We lost
I'm
the
taking over
speaker.
from Beth, but I want to thank our two teachers from Cheki. Hello? Hello?
Yes, Victoria? Hello, dear colleagues. I think Victoria and Bernard have lost the connection, so I can continue. Okay, I think.
Please go ahead.
Are you back, Bernard? Okay, so please take over then. Okay, thank you.
All right, can you hear me?
Yes, we can hear you.
So let's move back to Mosasa, Miss Regi Mosasa, if you are there. Can you hear us? Regi? Let's move to Charlotte Bergin, Miss Charlotte Bergin, who is coordinator of capacity building at the Interagency Network for Education in Emergencies, who is going to talk about what works and what doesn't work on teachers' well-being. Charlotte, can you hear us?
I can hear you well. Can you hear me?
I can hear you very well.
Great.
Please go ahead. The floor is yours. You have 7 minutes.
Thank you. Could we display the PowerPoint, please? The slides.
Henok, can you display the PowerPoint?
Thank you so much. Hi, everyone. It's wonderful to be with you all today on such an important topic. So I'm here from the Interagency Network for Education in Emergencies. And before I get started, I just wanted to share a quote from a teacher, as a reminder to myself and to all of us today about the incredible work teachers have been doing during this incredibly complex time. So as one teacher said, one thing that became clearer to us is that during this period, the work that we are doing is tremendous. It requires all of us to work together. What we are doing is more important now than before. And I'm conscious we're talking a lot about the challenges today, but this quote for me reminds me that even in the midst of these challenges, teachers continue to do incredible work. So yeah, we'll go to the next slide, please. So those of you who don't know, INEE, the Interagency Network for Education in Emergencies, is a global network of we've got over 17,000 individual members covering 190 different countries, and members can be anyone. It's free to be a member. I'd encourage you to join if you haven't already. From NGO, UNs, Ministries of Education, teachers, students, anyone can be a member, and we exist for and because of its members. And so I'll be talking today a little bit about the lessons we've learned from our members related to teacher wellbeing. Next slide, please. Thank you. And just again, just a reminder about our network that we bring people together with our shared mission to ensure the right to a quality, safe and relevant education for all who live in emergency and crisis contexts through prevention, preparedness, response and recovery. So INEE has been working for many years in education and emergency settings. Now, COVID-19, of course, presents an additional challenge, an additional crisis on top of many existing crises. And while that is incredibly complicated, it also is an opportunity to remember that we do have lessons that we have learned. There are things that we know and that we can use and adapt from previous crises, albeit recognizing that this is a very unique situation in a unique time. Next slide, please. Oh, thank you. So teacher wellbeing is such an important issue, and I'm so pleased to see it prioritized here today. And teacher wellbeing is something that we've been talking about at INEE for some time. There's a need to prioritize teacher wellbeing. Before COVID-19, there was this. It was such an important topic that was often neglected. That there are teachers working incredibly challenging settings already, and in a way, COVID-19 has kind of elevated the importance of this issue, and perhaps give us an opportunity to bring it more to the forefront at both policy and programming levels. And just to say, INEE, during this time, you can go on the website. We do have a lot of open source resources about teachers, supporting teachers, and also about psychosocial support and social emotional learning, and the many lessons we've learned from years working in emergency settings. We have also got dedicated resources around COVID-19 specifically that we've been collating in the last few months. So again, I would just encourage you to see those resources as they may be useful for your own work. Thank you. Next slide. So before COVID-19, we had been doing some work around teacher wellbeing that may be useful to your work. Indeed, we published a landscape review looking at teacher wellbeing in low resource, crisis and conflict affected settings. And within that review, we explored definitions of teacher wellbeing. So recognizing that teacher wellbeing encompasses how teachers feel and function in their jobs, that it's very context specific, and that it includes teachers' affectations, attitudes, and evaluations of their work. And why is it important? Well, we've heard so many examples today, but teachers' wellbeing correlates with creating healthy relationships with students, managing classrooms effectively, implementing social-emotional programs well, and improving the classroom climate for all. So we really need to be focusing and prioritizing this issue before the current pandemic, but particularly now during it. And in this report, you'll see on the next slide, we developed a conceptual framework to help us think about teacher wellbeing. If we just go to the next slide. And I won't spend too long talking about this, but if it is of interest, you can find it in the report. But it really tries to think about, what do we mean by teacher wellbeing? What does it mean at the individual level? What does it mean at the school level? What does it mean within the community? And what does it mean more broadly at sort of national, regional and global levels? What we're trying to do now is capture as many case studies and examples of work that can be done at these different levels to support teachers in their well-being. And I'll make sure to share the report afterwards. Thank you so much. Next slide. But today, let's talk more about teachers' support during COVID-19 and the core considerations. And these are things that we're hearing from our many members working in many different contexts that seem to be applicable to all of us now working in these uncertain times, and particularly relevant as we think about school closures and school returns currently and then moving forward. So the first thing that we're hearing from our members when it comes to teacher wellbeing and COVID-19 is the importance of listening to teachers. It was so wonderful just to hear from two teachers themselves and their own experiences and the work they're doing. And something about well-being that's so important is that sense of agency. And we know that teachers have incredible knowledge and experience. They're the ones who know their students. They're the ones that know their classroom so well. And so we need to be better at listening to teachers when we're developing policies, when we're developing programs, when we're developing teacher professional development. And the more that we can include teachers and work with teachers, the more effective we'll be. At the start of the pandemic, Education International released a fantastic study with asking teachers about their experiences, and many reported that they hadn't been consulted, that they hadn't been included in decision-making processes. So I think the more we can do that, the better we will be in our response. The second has already been mentioned today, and this is the need to protect teachers with our plans and with our policies. And as I think the first speaker mentioned, the UNESCO Teacher Task Force have released some great resources to really help with this, both policy guidelines while teachers aren't in schools and then once they return to school. Some of the challenges that we've been hearing a lot have been around teacher pay during school closures, and with school returns, particularly around teachers' health and security. And so making sure those policies are in place is really important. And also learning now and planning for the future so that next time, if there is a next time, which hopefully there won't be, but if in similar situations, we're more prepared to ensure policies are in place to support the teachers. The third thing we're hearing is that this is an opportunity to advocate for greater teacher support. We can really, I think everyone has realised at this time the important role that teachers play in our society, in our communities, and how can we leverage that to get that recognition for teachers to improve the policies and practices that affect them every day in the future. And then there's some really important programmatic things we can be doing. And these are some of the examples our members have been sharing with us and that you can find on the INE website. So in particular, we need to provide teachers with teacher professional development to support them in these uncertain times. We often think about the multiple roles that teachers play in any setting, and particularly in crisis settings. If they're being expected to provide health messages, if they're being expected to provide psychosocial support for learners, how are we equipping the teachers to do that? So we need to quite quickly adapt teacher professional development models to support teachers at these times. That means thinking about the modalities. If we can't bring teachers together in the training room, we should be more creative and provide more ongoing support to teachers. So thinking about using radio, mobile phones to provide peer support, to provide coaching to teachers at this difficult time. And we have some great examples of where and how that's being done. Similarly, changing the content. We need to be adapting teacher professional development to equip teachers with the skills they need at this time. The skills we're hearing are perhaps around digital and technology solutions. Teachers are being expected to support learners using distance education, but are they being equipped with the digital skills they need to do that? Teachers are also being expected to provide psychosocial support, but are they being given the skills they need to do that? And we heard a lot today about teachers being expected to play now a role in the health of their learners and providing that detailed information on COVID-19 and the pandemic. Are we supporting the teachers on that? And so adapting teacher professional development, both the modalities and the content, to ensure that teachers are enabled to do their job well is going to be really key for their well-being. Similarly, and this came up today as well, providing direct well-being support to the teachers. So there are some interesting examples of this that we've learned from life before the pandemic that have then been adapted and adjusted for these times. So that might be just phone calls to check in on teachers. This might be providing mental health and psychosocial support services to teachers via mobile phones and digital technologies. But it might also be around facilitating peer support where that is possible, providing some of our members have developed. Hi there.
Can you hear me? Can you wrap up in 1 minute?
Yes, perfect. Some of our members have developed socio-emotional learning curriculum for the teachers themselves, PSS and SEL for the teachers themselves. And again, on the INE website, you can find some great case studies on this. And lastly, we talk a lot about technology, and we often hear technology being talked about directly to the students, but how can we leverage technology for teachers? Even during the school returns, we've learned a lot of lessons in recent months that we can hopefully apply moving forward to provide greater support to teachers. So we've seen great examples of radio, for example, of WhatsApp and other mechanisms, and these can be continued. So I'd encourage us to use that conceptual framework I shared to take forward these considerations. We do have some great examples of these that we'd love to share with you. And if we can move to the next slide, it looks like maybe it's frozen, but I was just going to talk about some of the resources that are available. As I mentioned, we're trying to collect as many case studies as we can of work that is being done, and we'll share those on the INE website. If you have resources and examples that you would like us to share for free via the network, please do let us know. I'd also encourage everybody to look at the UNESCO Teacher Task Force resources, which have been really helpful for so many of our members. In the coming weeks, we're hoping to share more technical guidance and technical resources around providing psychosocial support and social-emotional learning for teachers at this time, and supporting teacher well-being. But as I say, if you go on the INE website, you can access all of these resources, and we'll continue to update it. You'll also find a webinar we did a few months ago where we had presentations from UNHCR, Education International, Unesco, War Child Holland, UNRWA, other organisations presenting their efforts that might be particularly of interest to this group. I'll stop there. Happy to provide more detail as needed, but I know we've got lots to discuss today, so I'll stop there, Bernard, but happy to answer any questions. Thanks, everyone.
Thanks a lot, Charlotte, for that interesting presentation. If there are any links you want to share, please type them in the chat box so that people can visit them afterward. So now I'm going to check if Reggie is there. If not, we'll move right away to the chat moderation. Reggie Montasa, are you there? Miss Reggie Montasa? So apparently Reggie still have some connectivity issues. Now we move to the chat moderation. Victoria, can you hear me?
Yes, can you hear me?
Yeah, I can hear you very well. Now, can you please, if there are any questions that were raised in the chat moderation, would you please?
We have a lot of questions, a lot of comments, but I'm going to request that because we have about 12 minutes remaining, if it is okay with us, we flip around the program and have the presentation from WHO come through first, and then we can conclude with the remark, comments, questions, if that is okay with the team. Okay.
That's fine with me.
Okay, so let me request the colleagues to upload the presentation from Dr. Simplis Mbola from WHO in Brazzaville, so that we can have it briefly, and then I'll summarize what is coming from the chat room. Otherwise, it has been very, very active, and thank you so much, colleagues, for keeping it active. So, Jose, please upload the presentation for Dr. Simplis.
So, Dr. Simplis, can you hear us?
I can hear you.
Perfect. All right.
Can you hear me?
We can hear you very well.
Okay.
Please let us know when you can see the slide and you are ready to start.
Okay, I can see the first slide.
Please fire away. You have 10 minutes.
May I come in? May I come in?
Yeah, sure.
Okay, thank you very much. Good morning, good afternoon, colleagues. My name is Simplice Mbola. I'm working for WHO as a Regional Technical Advisor, responsible for adolescent, youth, and school health, based in Brazzaville, Congo. So for me, it's a pleasure to participate in this webinar and share some slides with you. As you know, schools are not only places of learning, but it's also institutions that provide social protection, nutrition, opportunities for physical activities for young people, and also educators, the teachers themselves, and health, and also health and emotional support. In the context of the COVID-19 pandemic, as you well know, schools, other education and training institutions closed in more than 190 countries in the world. Given that context, it is important that the activities proposed are inclusive of COVID-19 related issues. For instance, the safe reopening of school, among other pertinent topics. Next slide, please. Next. Please, next slide.
Next slide is already on, I think. Role and responsibilities.
Okay. In the face of public health crisis, regionally, internationally, and outbreaks, WHO roles and responsibility are to develop and disseminate evidence-based guidance and guidelines. This aims at supporting member states to better prepare, response, and mitigate the impact of the health crisis. Another aim is to support countries to keep, in this context, to keep the school environment safe for students and also all actors operating in this area. So, WHO, in collaboration with other partners, have developed key documents. Some were released and some are still under development. The first document that was released in the context of COVID-19 pandemic was a guidance on considerations in adjusting school-related public health and social measures in the context of COVID-19. This guidance is useful and helpful for countries to adjust their strategies according to the situation of the pandemic. Another document that was released, you can find it in the website of WHO, is a kind of Q&A on school and COVID-19 pandemic. It is a range of questions and answers pertaining to school, notably school reopening. So you can have it in the system, in the website, with a number of questions and also answers. WHO also, in collaboration with other UN agencies, is in the process of developing a COVID-19 school framework. This will be a practical tool to support school to better prepare and respond to COVID-19, and this will be published shortly. I am not in the position to provide with you the exact date, but I know that in the coming months, this will be available, this tool. Under development, WHO is also working on the guidelines on school health services. These guidelines aim to provide national government and other stakeholders with detailed guidance on the effectiveness, acceptability, and content of comprehensive and multi-component school health services involving health workers. This will be the first guidelines on school health services. The primary target audience consists of policy makers, program managers, private and all stakeholders operating both in the area of health and education. And this will help member states to strengthen collaboration between the two sectors, namely health and education. These guidelines will be published on October or November this year. Another guidelines that we are working on is the one in relation to mental health, promotive and preventive intervention for adolescents, what we call helping adolescents to strive. This one will provide evidence-informed recommendation on promotive and preventive psychosocial interventions for mental health in adolescents. The target audience for this one is policymakers, planners, managers, and non-governmental health care programs, and all people working in the area of health and education. This document will be available either on October or November this year. It will be linked to the World Mental Health Day. In terms of the next step, when all these key documents will be, do you hear me, please?
Yeah, we can hear you.
Yes, we hear you.
Okay. Okay. I will say that in terms of next step, when all these key documents will be available, these will be disseminated across all regions. Also, WHO in collaboration with other partners will support countries to strengthen their capacities on the use of these guidance and guidelines, and also provide technical support to adapt this document if need be in order to align them with the national context. And also WHO will be working to mobilize partners to support member states using, adapting, and also implementing all these guidance and guidelines in order to support countries to mitigate. Yes?
Will you wrap up in the next 2 minutes, please?
Okay, just 1 minute. I will say that all this work is to support countries to better mitigate the impact, the negative impact of COVID-19 pandemic, and also to keep the school environment safe for children, students, and also teachers. Thank you very much. Over to you.
Thank you so much, Simplice, for the presentation and presenting those different guidelines and the documents. And now, Victoria, can you hear me?
Yes,
Hello?
can you hear me?
Yeah, I can hear you.
Okay.
So the floor is yours for raising the question that have been asked in the chat moderation, in the chat.
Okay, thank you very much. Thank you, colleagues. Thank you to all our speakers. We are having quite a blast in the chat room. Quite a lot of questions have been raised, and some have been comments, and others have been appreciating the presenters. We really want to thank you so much. Now, I'm going to wrap it up very fast, then I'll end with the questions to the speakers. I hope you can still hear me. I'm not very sure of my network, but I'm trying.
We can hear you
well. Very well. So one of the key things that was raised is that colleagues feel that there is need for remodeling the teacher training curriculum as we face this pandemic, so that our teachers are better prepared to be able to mitigate situations like this that we are going through. And also the other aspect was about making sure that when we are talking about teachers, we are also paying much attention to those teachers who are teaching in the private schools, who have faced the tougher times, because quite a number of them have lost their jobs during this period, and some of them their contracts haven't been renewed. So we need also to be balanced and look at those in the private schools. Then there was also an issue that came up in terms of how do we ensure that our governments support the teachers and the lecturers, again, in the private education institutions, to make sure that they are not scrapped off the payroll amidst this whole saga of the COVID-19. So in terms of their well-being and to keep them motivated, how do we advocate to make sure that our teachers are well catered for? Now, the other aspect is the issue of, I'm reading through because there are quite a number of things. I think we need to adapt a flexible mindset. This was also another comment that was raised in terms of future interventions to support the teachers, and also to make sure that we prepare them well enough to embrace the new modes of teaching and learning. It looked like we had been preparing teachers in the use of ICTs for teaching and learning, but I think they hadn't really adjusted to that new delivery mode. So we need to prepare our teachers better beyond the chalk and talk to make sure that they can easily adapt to these different types of modes that we are now utilizing in terms of using the social media, in terms of using the internet, the Zooms, the Teams for teaching and learning, and also prepare the parents as well. That is one thing that came up. Then there was a concern from proprietors of schools, especially those that are run by faith-based organizations. Some of these schools can no longer afford even to pay salaries for teachers, which has become a stressful situation. How do we intervene and support? Lastly, there was an issue of reopening the schools for countries that haven't yet reopened. How do we help them to become ready? How do we make the system to be ready so that teachers are equally prepared and are ready to start to deliver on their courses or their teaching, on their lessons with a clear mindset? And as you've listened from the teachers from Zambia and Senegal, there's resume the classes and just the school reopening. Now, I'm going to end up with 3 questions which have been targeted to, one is for Patricia. What is your comment on teachers' medical insurance? It seems like it wasn't, in many countries, it hasn't been given a lot of attention. So what do you think about teachers' medical insurance? That's how it was presented, and I'm giving it to you the way it was presented. Another one was presented to Antonietti from Gambia Teachers Union, and they wanted to know in the Gambia if teachers are still considered among the non-essential workers. Are they essential or they are non-essential workers? That was from the Gambia. Then there's another question that is posed to all panelists. How do we ensure a balance between science and practicality of implementation given the resource constraints that we are having, especially in the global south? Because some of these guidelines that we have been talking about seem to be like a one size fits for all, but how do we balance between science and practicality to implement some of these guidelines in the resource limited settings? I hope you've heard me very well. Okay. Over to you, presenters. Thank you.
Thank you, Victoria, for the questions. I think the question directed to me was around teachers' medical insurance. I think there's something that I covered in the presentation around that. I think the experience for most of the countries would be that teachers are covered by the public service medical insurance, which is, which covers all the civil service. But the challenge, I think, where there is lack of adequate medical cover in most cases is for teachers in the private schools, who in some cases may not have adequate medical cover to cover them, for example, in the case of COVID-19, but also for those who are who are covered by the public service. In some cases, some of the services that are required, for example, around psychosocial support counseling, may not be covered by the medical cover. So I think, but the big challenge that was highlighted was around teachers who are in the private service who may find themselves without adequate medical cover. Over.
Thank you very much, Patricia. Antonietti, are you still there? Okay. If she's not yet there, I hand over to Dr. Simplice if you have any comment on some of the issues that have been raised. I know that Charlotte is also online.
Okay.
Yeah,
I'm
feel
here.
free to come in.
Okay. May I come in?
Please go ahead.
Okay. There was a first question regarding the WHO position about potential vaccine and also treatment regarding the COVID-19. In the context of this kind of crisis, WHO is supporting all initiatives that can conduct to the development of a vaccine and also a treatment based on the evidence. Yeah. WHO is not in charge to develop a vaccine, but encourage all the initiatives all over the world to develop a vaccine and also a treatment. I would like to insist on the fact that this vaccine or this treatment should be developed in accordance with the evidence that can be generated or also available. Another question was in relation to children. I would like to say that children can be infected, but most of them are asymptomatic, but they can transmit the virus to another person, notably to adult person. So there is a need to observe all the protection measures for us as adults and also for children. And then the last question was in relation to the balance between science and also practicality in the context of the resource limited settings. In the African region, in the context of public health, countries are facing several crises, several issues, several threats. That's why I was saying that one of the role of WHO is to mobilize international partners and also national communities to leverage additional resources in order to provide robust response to the COVID-19 in our region. We know that it's not easy, but we have to do this. WHO should do this in collaboration with other UN agencies and also international and development partners. Over to you.
Thank you very much. Thank you, Dr. Simplis, for those responses. Marie, in 2 minutes, if you can just say something about what was raised in Gambia, for Gambia.
Yeah, teachers are essential workers because, as I rightly said, they've gone back to school and everybody knows that the important work the teachers is doing can never be overemphasized. So teachers, yes, are essential workers, even though the nurses are top on the agenda, but we know as a union that teachers are essential workers.
Thank you so much, Marie. In the interest of time, and I want to thank you so much for holding on, colleagues. Let me hand over to my colleague, Saliu, to give some wrap-up remarks.
Okay, thank you, Victoria. Good morning or good afternoon, good evening to everybody, depending on where we are. Thank you very much, everyone, for your time and being with us in the last 1 hour and a half. We have just listened carefully to the various presenters, and I thank them all for sharing information regarding the challenges they have experienced in relation to their well-being, health, and the need for socio-cycle support, and how their governments have supported or are supporting the health and well-being of teachers and teacher educators during this COVID-19 crisis. The topic is very important and timely, as many meetings have been held focusing on what teachers should do to support learners, but not much has been said on support to teachers, as we all know that when teachers' health and well-being are assured, they can support students and community. COVID-19 has affected teachers' well-being, as many may have lost their jobs and some have already seen their salaries reduced. As Unesco ILO recommends, supporting teachers' motivation and well-being is very important in school reopening and afterwards. While distance learning is seen as a solution towards providing education, while keeping teachers and students safe, the internet access is still low in many African countries, and I'm sure some participants have experienced that situation today. This calls for building on existing resources, addressing teachers and learners' access to appropriate media and technology needs. School heads and teachers need to feel safe before they can come to school. Prevention measures and psychosocial support need to be in place to help teachers feel safe and protect their well-being. Measures include sanitation, we heard from that. Measures include sanitation enhancement, regular testing, reducing class sizes to enable social distancing, providing face masks to teachers and students, and so on and so forth. Where ministries of education worked closely with teachers or teachers' unions, concerns were reduced and enabled the Ministry of Education to provide responsive support. Minimizing the risk also include prioritizing classes that are preparing major exams. Teachers need to be supported for playing role in ensuring the right information flows to community. We have learned from the presentations that psychosocial support is not expected only from the authorities, but from all parts of the society. The case in point is the non-stigmatization of those infected by COVID-19. Finally, I wish to thank all partners who have jointly worked with ICBA for the success of this webinar, which has allowed us to learn from each other and share experiences. Again, thank you so much for being with us, and we wish you a nice day and a safe and successful school reopening. Over to you, Victoria. Thank you very much.
Thank you very much, Celio. We appreciate those wonderful and thank the presenters, the wonderful presentations that you've given during these 90+ minutes. And thank you to all the participants. Thank you to all those that have been extremely active in the chat room. We really want to appreciate you. And we promise that you're going to have the presentations uploaded on the ICBA website. May you have a wonderful evening. Let's keep in touch, keep communicating, and we'll make this world a better place for all our teachers and learners. Thank you so much to our moderator, Bernard, Dr. Bernard Nkwibuasi. We appreciate you. Thank you all. Bye-bye.
Bye.
Thank you very much.
Thank you very much.
Thanks,
Okay.
colleagues.
Thank you.
Thank you.
Have a nice day.
Thank you very much. Thank you.
Bye.
Please stay safe. Bye-bye.